Why'd you come up with the name Shift? I always have to take a breath because I always feel like, all right, it's a long answer. The simplest answer for me is that we want to shift or change healthcare. I want to create a company that is an agent of change for the 21st century.
We were born before the wind, also younger than the sun.
We're integrating all these approaches. We're collaborating as a team together, and the team includes the patient. The patient is the center of the team, and that part is the narrative part, the story. And the story, the humanity of it all, is really what's gotten lost in medicine in general. Healthcare is in the news all the time. It's often described as being broken. And I think when they say broken, they're usually referring to the finances of it. But they're also alluding to the other experience that people have in going to the doctor, going to physical therapy. That part seems broken also. And that part of it is under my control.
All right, so we're going to start on the right side just to see what normal is for you.
We're a large office. We've been around for 15 years. We are affiliated with NYU, Hospital for Joint Diseases, Hospital for Special Surgery. We are a mainstream traditional physical therapy, very skillful orthopedic setting. And what I want to add to that is the piece that's missing. I guess it was 2 or 3 years ago, I had prostate cancer. I had a fantastic surgeon at Sloan Kettering. Surgery went smoothly and I don't have any risk for it. But what did happen that was very important that led to the shift was my wife recommended that I see an acupuncturist. Over a 2-year period, I went every week, and it was transformative. It was amazing. And I became very sensitive to energy. Acupuncture deals with energy meridians. In physics, you deal with energy all the time. It's very concrete and real. There's nothing abstract about energy. And then when you say, oh, I'm going to work with the energy in your body, whoa, that sounds impossible. Well, you can think whatever you want to think, but my personal story is I could feel the change in my energy day to day. And one day I went back to my office and I looked in this large gym. There's 10 physical therapists there, massage therapists, occupational therapists. And everyone's like stretching and range of motion and doing exercises, and that was always kind of cool. But I'm looking and I'm thinking, we don't even see or deal with energy whatsoever. I think it would be kind of miraculous to go to physical therapy and have someone there where you felt safe and they were vetted and the person was able to co-treat you with acupuncture, with your physical therapist, and use essential oils, and you do energy work or whatever. I want to have a truly integrative office. What does that mean? In a truly integrative setting, it's all happening at the same time. And that, I think, has never been done before. Now that I want to create change and create a shift in my office and bring integration into the office, how do I do it? Initially, I hired a number of acupuncturists, a number of people that would have coverage all day long, and I was willing to offer the acupuncture at the lowest possible fee. I mean, it was like $15 or something, just to help me cover the cost of the acupuncturist. Well, 2 months into it, I was going broke. Rachel, in my office, my colleague, had met a doctor at NYU, and he had people in his office doing acupuncture, and they were volunteering.
Tri-State Acupuncture College actually teamed up with NYU and came up with this externship program.
Right.
Externs are the graduates that graduate from acupuncture school. Now,
right. Which is a master's degree, right? 3 years.
It's 3 to 4 years, depending on the training.
Right.
And over 1,000 clinical hours. They've got a lot of.
Yeah, I don't think people realize that. I mean, I don't know
Maybe
if they
they
think.
don't. Yeah.
I don't know what they think it is. I think even physical therapy, they don't realize physical therapists go to school for 7 years.
Imagine you've got all this training.
Yeah.
In this Oriental medicine.
Right.
And you graduate and you have nowhere to work.
Even if you're pretty good at it, you're only busy 2 days a week.
Where can they go where real patients are coming with pre and post-op conditions, who are coming with injury?
Right, which it is used for in China for all of the above. But you spoke to this doctor and you were surprised to find out that besides him, all the other acupuncturists that were working with him were volunteers.
They are volunteers.
And the light bulb went off in your head that said, I wonder if we could do that same thing. So Rachel went to Tri-State Medical College, met with Peter Dubitsky, who's the clinical director there, and we created an externship in our office.
When you presented your interest in having externs come work here, I thought, well, this is a great opportunity.
I thought it was a good idea.
Yeah.
That's, first of all, it was so nice to hear at that time, I remember, but I'm also thinking for myself, meeting acupuncturists and asking them, how would they feel about working in a physical therapy practice? What they would say is acupuncture partners really well with physical therapy. Mm-hmm. And the explanation they would give me is, I'm treating people, it could be for pain, I'm treating them for symptoms, immediate relief, mm-hmm. but I don't have the time to maybe talk about what exercises they need to do or other types of postures or positions they should be avoiding if they mm-hmm. have tendinitis, for example. It would be really helpful if if a PT could talk to my patients and do some exercises
Absolutely.
in addition to my treatment. Mm-hmm. And I thought, oh, that makes perfect sense. And by the way, ours is sort of the opposite. I always sort of judge physical therapy and think we're really good at the evaluation, diagnosing what is the cause of this and what's the physiology of the injury. But what we always do is say 2 to 3 times a week for 4 to 6 weeks. Mm-hmm. And I'm like, can't you give the person a little relief right now? I mean, they're in pain.
And the acupuncturists have to learn how they can be, instead of being a standalone treatment, providing
right.
an hour or an hour and a half
right.
of evaluation and treatment for the patient, how they can be part of a treatment where it's not just their patient. This is a shared patient with 2 different specialists providing the best that they can give to this patient. So the acupuncturist had to learn how they could change their orientation.
My goal was to really have a collaboration where a patient would benefit mm-hmm. from a PT and an acupuncturist sharing information, mm-hmm. different types of evaluation, but sharing what they've found and coming up with a creative idea of how to treat that person. And mm-hmm. the person wouldn't have to go from one evaluation, literally go pay and then go sign up and fill out more forms and then go to another room and then do a whole nother evaluation and then no conversation took place. It was just the opposite. It was literally, can we all talk?
I don't think that there's any physical therapy practice that is doing what you're doing. This is really a unique vision, and I think you're succeeding at it. It's really great.
The other thing we did, a similar approach, was with Donna Karen's Urban Zen Integrative Therapist, which they refer to as UZITs. They do restorative yoga, they use essential oils, they do mindfulness. Reiki is a big component of it.
I've been a nurse for 40 years. For the first 20 years, I've been involved in ICU, ER, open heart surgery, hemodialysis. I've done all of that.
I started out with a background in yoga and yoga instruction. Then I became a professional massage therapist, first in California and then here in New York.
I went to work one morning and I heard a doctor at my job talking about Urban Zen and that they were looking for nurses. They had a nursing scholarship to help to bring these modalities
right.
into the mainstream healthcare system.
In 5 minutes' time, we can complement any therapy by adding a component of mindfulness to it, by adding a perspective of the whole patient approach.
This is all about shifting out of the head.
Yes.
Doing the energy work. It's really just helping to calm our minds.
A lot of times due to the stress of an injury and going to the doctor and all the stress of your life, you're in a fight or flight state. All of the attention of the nervous system and the muscular system is focused on getting away, fighting or running away. That is not the state to be in for healing. It could be interfering with your range of motion. It could be interfering with your pain level. It could be interfering with your swelling that won't go away. Your body needs to be in a state where it's optimally trying to heal itself, not escape or fight back.
We know that if we are able to bring a patient to a calmer place before going into surgery, coming out of surgery post-op, they're actually in a much better place emotionally. And the healing process tends to be quicker. Can we quantify that right now? No, we're working on it. But we know as practitioners for sure that it works.
A great memory of this transformation in the office was we had a bunch of UZITs there and we had a bunch of externs from Tri-State and a full staff of physical therapists. And it's an open setting, my office, so I could walk down and there'd be tables next to each other and one person is getting physical therapy. And the next person next to them has needles in their back or their neck or in the forehead, and it's just a funny juxtaposition, and not just funny, but to me, miraculous.
These integrated therapies make a difference in 2 ways. There's the the actual benefits that one can receive from a session of Reiki or acupuncture. The second and maybe more important benefit of having this integrated therapy here is that it makes everybody, the practitioners and the clients, everybody in the room starts to feel like, hey, this is more than just about an injured knee or a broken leg. This is about the big picture, and we do need to consider that.
When I think of the Shift Physical Therapy and how we're making a change and what our model is, there's 3 words that come to mind. It's integrative, it's collaborative, and it's narrative. In my office, I find it's really important to represent that truly integrative model by having it all done in one space. So if you're coming for physical therapy, and that is the main reason people are coming to my office at this time, if you're coming for, you had knee surgery or something.
So basically what's happening is this leg, basically the whole side, is just significantly weaker than the right, especially up at the hip. So what we want to do is, first of all, take care of some of your soft tissue restrictions. Your calves are super tight.
So we're doing our rehab, we're doing our physical approach to your knee. The physical therapist may say to you, I think acupuncture might be beneficial for you, for your pain or your swelling or your healing or whatever. Would you be interested in that? That's how we're going to propose it. Now, if you are, I'm not going to send you to do a whole nother evaluation down the road to a person who has a separate business, who is going to speak a different language now, and possibly, inadvertently, give you conflicting information.
Hi, Erin. I'm Mila. I'm your acupuncturist. It's nice to meet you. I spoke to Galen, and she said that you're having some pain in your knee.
We work as a team, and not only that, you're going to have the acupuncturist going to come right to you and talk to you and explain how she evaluates you, and not do it in an hour, but do it in a reasonable 15-minute slot of your day. We're trying to come up with all of these great healing modalities that approach the body in different but very powerful and important ways, and give you access to them because everyone heals in a different way. So one approach is not the answer for every diagnosis. It's only going to work if we truly collaborate and work together, and it's a team approach.
All right, all needles are in. Are you comfortable? Yes. Yep. Okay, so I'm going to let you rest for 10 minutes. And when I get back, we'll take those needles out. Okay.
We first collaborate with the patient. The team includes the patient. The patient is the center of the team. And that part is the narrative part. In the program that I'm in narrative medicine at Columbia, the premise is that doctors, physical therapists are scientifically trained very well. But going to the doctor, the experience of going to the doctor and the doctor working with a patient is not all science. There's a human interaction there.
I think it's important to send patients to a center where they can get not only just physical therapy work, but the whole host of complementary treatments that are going to address the problems that they have, whether it be through acupuncture or just talking to patients, making them feel at ease, spending the time with them so that they can actually understand all the factors that are going into this patient's pain.
The competence to be able to listen to a story and not make it their own. And to even recognize that they're part of the person's story from that point on. Once you meet the person, now you're part of their story.
People coming to the office with all different stories, all different injuries, all different things that have happened to them that brought them to this place.
Right.
Okay, but behind that is their whole story, is their whole suffering. You know, that there's so much more going on with the person when they enter this office. That again, that they're suffering with.
So there's a tip of the iceberg for what we're treating.
Absolutely.
And then when you engage with them, you see or feel or hear the depth of their human struggle.
Absolutely.
Is that right?
Absolutely.
That's amazing.
I treated a man here once, and he was an ex-Marine. And he was here for an injury, you know, that certainly had nothing to do with that.
Right.
But I know when I started to treat him, I could sense whatever deep emotion he still had struggling with that. And I know that that place of peace that he came to did a whole lot more
healing
in terms of healing than just whatever physical disability was going on.
Right.
I mean, if we just focus on the physical being, we're really depriving ourselves.
We're integrating all these approaches. We're collaborating as a team together, and the team includes the patient. The patient is the center of the team. And that part is the narrative part, the story. And the story, the humanity of it all, is really what's gotten lost in medicine in general. Creating this model has been a process. It's been an enjoyable process, but it takes time. And when it's all done and everyone thinks the same way, it's going to seem like, why was that a big deal? Patients want it and they deserve it. And that's why it's going to work.